Hello, my name is Dr. Chris Mendoza at Rocky Mountain Dental Anesthesia. Just like to say hello and just kind of go over a few things with you as you and your child prepare for anesthesia in the dental office. First off, common question I get is it common for my child to receive anesthesia for dental work? And the answer is yes. Typically at our practice, we see children 2 and up every day or 5 days a week, all throughout the year, often just because there's a lot of dental work that needs to be done, and it's often easier for the dentist and for the child's sake that they go under anesthesia and get all that dental work done at one time instead of creating a traumatic experience for them. Our primary goal is the safety of your child, and we're going to try to make this the most comfortable process and the easiest process as possible. So we want to go over a few things with you. First off, you should have received or you will be receiving a packet from us, and it's going to go through medical history. It's going to have the consent forms, the financial information, and information about the procedure as well. So if you could please fill all that out, read through it, and return it as soon as possible. This will just ensure that we don't have any delays or have to reschedule you for your appointment. We really want to make sure that we can look at your child's medical history ahead of time, because this is extremely important for us to create the proper plan for them. So the sooner that you return it, the easier it is. If you do have any questions for us at any point, you can reach out to us via email, call, text, anything like that. Regarding the day of anesthesia, first thing I want to go over, it's very important to adhere to the MPO guidelines, mainly nothing to eat within 8 hours of the procedure, although water or apple juice, Gatorade, things like that can be drank up to 2 hours before the procedure. It's very important to follow these instructions. It's for your child's safety. We're not trying to torture your child, but it's part of the process. We want to make sure that there's no issues with them throwing up during the procedure. For kids, we typically will bring them in, we'll do a preoperative assessment, and then we will have what we call a mask induction for your child, so they don't have to see any needles, nothing like that. You can be in the room with your child during this part. We just have a little mask, goes over their nose and their mouth, and all they have to do is breathe that in 10 times really big, and that's what gets them off to sleep. A couple things might happen as they're going to sleep. Their eyes might start to roll around. They might start to wiggle a little bit as they're starting to get deepened, and that's fine. It looks very scary, but it is normal. It is also normal for your kid to fight a little bit, because honestly, if they've had a bad experience at the dentist, that's why they're going under anesthesia. So don't be ashamed, alarmed if they start to fight, anything like that. We'll just hold the mask on, get them off to sleep comfortably, and then we'll have you step out of the room once they are asleep. During the procedure, we'll be starting a little IV, either in their foot or their arm. We'll place a protective breathing tube, goes through their nose, protects their airway, so the dentist can work quickly and efficiently throughout the procedure. Okay, so once we're done going through the pre-op assessment with your child, then we'll bring you and your child back to the anesthesia room. Bailey, my assistant, she's going to be our child today. So we're going to have her sit up in the chair right here. And during this part, you, the parents, can be here for this entire time as she's getting ready to go to sleep. So the first thing I like to tell the kiddos is all they're gonna have to do is take 10 really big breaths in this little mask. The mask, it does smell a little stinky because of the medicine going through. We'll try to put some flavoring in, but sometimes it still smells a little funny. And again, you can be right here during this entire time. So what I'll do, I'll turn the machine on and then gently just place the mask right here on our child Bailey. So a few things. After the first few breaths with the medicine, with her breathing in the medicine, she won't remember anything. Now a couple things might happen as she's going to sleep. Her eyes might start to roll around a little bit, even to the back of her head. It looks very scary, but it's normal. The other thing that might happen as she's going to sleep is she might have to have these like wiggles or twitches, which can look very scary, but again, that is normal too. That's just a part of her going to sleep with the mask. Now, once she is asleep, I'll kind of check her eyes like this. She's awake, so I'll check her eyes. Once she's asleep, we'll have you give her a kiss and then wait back out in the car or the waiting area. At that time is when we'll start an IV, place our breathing tube, and make sure we do everything we have to get ready for the procedure. We'll also be placing on some monitors, which we have right here as well. Once they're done with the dental work, we take the breathing tube out. We take the IV out before your child wakes up. And we want to bring you back before your child wakes up so you can be there when they do wake up. This isn't always possible in every case, but we do our best to make sure that you're with them while they wake up, and then to remove the IV before they're fully awake. When we do bring you back, we are going to go over all the post-operative instructions and go over a few things like drowsiness is very common. Your child might want to go back to sleep for a few hours and be sleepy for the rest of today. They will be able to eat immediately following the procedure. However, we recommend starting with easy foods and easing into more normal foods as long as those easy things are tolerated. And we'll bring you back. We'll let them recover for 20, 30 minutes or so. And then once they open their eyes, they'll be able to go. But again, they will probably be very drowsy for the rest of today. I hope this answers most of your questions. If you do have any additional questions, feel free to reach out. You can call us, you can email us, or even text us as well.